What's the difference between MS or multiple sclerosis and CIDP, chronic inflammatory demyelinating polyneuropathy? I put out a video yesterday about CIDP and a lot of followers mixed it with MS and they thought it's the same disease. So I thought I'll talk today about both diseases and how we differentiate between the two because they are totally different. Now, CIDP is a disease of the peripheral nerves in the extremities, where the immune system attacks the myelin that covers the peripheral nerves, producing the symptoms. MS is a disease of the central nervous system, the brain and the spinal cord. The immune system attacks the myelin in the brain and the spinal cord, producing the symptoms. The presentation is also different. With CIDP, typically presents with weakness, numbness, and tingling sensation of the extremities. Now, at times, it can involve the cranial nerves in the head. However, MS, depending which area of the brain is affected or the spine, it can give symptoms of optic neuritis, difficulty with speech, difficulty with balance, weakness, numbness, and tingling sensation, loss of bladder control. Now, the diagnosis is totally different between the two. So we have the CIDP is diagnosed with nerve conduction test of the peripheral nerves. With MS, we do an MRI of the brain or the spinal cord or both. At times we do a spinal tap for both of them. However, with each we look for something different in the CSF. And the treatment is different. With MS, we have specific medications and therapies for it. With CIDP, we also have different therapies. At times, we might use the same medication to treat both, but this is not always. Thank you.